Metabolic syndrome, sometimes referred to as Syndrome X, is a cluster of conditions that occur together, significantly increasing an individual's risk of developing serious health problems such as heart disease, stroke, and type 2 diabetes. It is not a single disease but rather a constellation of interrelated risk factors that share a common underlying pathology, often linked to insulin resistance, obesity, and inflammation. The syndrome has become increasingly prevalent worldwide, paralleling the rise in obesity and sedentary lifestyles, and is now considered a major public health concern. Causes and risk factors. The primary driver of metabolic syndrome is insulin resistance, a condition where the body's cells do not respond effectively to insulin. This hormone is essential for regulating blood glucose levels. When insulin resistance develops, the pancreas produces more insulin to compensate, leading to hyperinsulinemia, which contributes to fat accumulation, particularly in the abdominal area. Genetic predisposition plays a significant role, as some people inherit a tendency toward insulin resistance, high blood pressure, or abnormal cholesterol levels. Lifestyle factors are equally critical. A diet high in refined sugars, saturated fats, and processed foods, combined with physical inactivity, accelerates the development of the syndrome. Other contributing factors include chronic stress, smoking, age, and hormonal changes, particularly in women after menopause. Key components. Metabolic syndrome is diagnosed when a person exhibits 3 or more of the following conditions. Abdominal obesity, excess fat around the waist, often measured by waist circumference. Central obesity is a critical component because visceral fat is metabolically active and contributes to insulin resistance. Elevated blood glucose, fasting blood sugar levels higher than normal or impaired glucose tolerance indicate prediabetes or diabetes risk. High blood pressure, persistent hypertension adds strain to the cardiovascular system and exacerbates the risk of heart disease. Dyslipidemia, this involves abnormal cholesterol levels, including high triglycerides and low high-density lipoprotein, HDL, cholesterol, which are risk factors for atherosclerosis. Pro-inflammatory and prothrombotic state, many individuals with metabolic syndrome have elevated markers of inflammation and clotting tendencies, further increasing cardiovascular risk. Symptoms. Metabolic syndrome is often asymptomatic, which means many people are unaware they have it until they develop complications like heart disease or diabetes. However, some signs may be visible. Increased waist circumference and central obesity. Fatigue or low energy due to insulin resistance. Skin changes, such as acanthosis nigricans, which presents as dark, velvety patches around the neck or armpits. Mild high blood pressure detected during routine checkups. Because the syndrome affects multiple body systems, its impact can be subtle yet profound, silently increasing long-term health risks. Complications. The presence of metabolic syndrome significantly raises the risk of serious diseases. Type 2 diabetes is a common outcome due to chronic hyperinsulinemia and impaired glucose tolerance. Cardiovascular diseases are particularly concerning, as high blood pressure, dyslipidemia, and inflammation accelerate atherosclerosis, potentially leading to heart attacks, strokes, and peripheral artery disease. Individuals with metabolic syndrome may also face an increased risk of non-alcoholic fatty liver disease, NAFLD, and polycystic ovary syndrome, PCOS, in women. Diagnosis. Healthcare providers diagnose metabolic syndrome through a combination of clinical assessments, blood tests, and physical measurements. Waist circumference, fasting blood glucose, lipid profiles, and blood pressure readings are evaluated. The diagnosis is made when at least 3 of the 5 criteria are met. Early diagnosis is critical to prevent complications. Management and treatment. Treatment for metabolic syndrome focuses on addressing underlying causes rather than individual symptoms alone. Lifestyle modifications are the cornerstone of management. Diet, A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help reduce insulin resistance and promote weight loss. Reducing sugar and processed foods is essential. Physical activity, regular exercise, including both aerobic and resistance training, improves insulin sensitivity and cardiovascular health. Weight management, even modest weight loss, 5 to 10% of body weight, can significantly improve metabolic markers. Smoking cessation and stress management, both reduce cardiovascular risk and improve overall health. Medical interventions may be necessary for certain individuals. Medications to control blood sugar, blood pressure, or cholesterol are commonly prescribed. In some cases, bariatric surgery may be recommended for severely obese patients to achieve substantial weight loss. Conclusion: Metabolic syndrome is a serious but preventable condition that affects millions globally. Its complex interplay of genetic, lifestyle, and metabolic factors requires a comprehensive approach, emphasizing healthy eating, regular exercise, and medical monitoring. Early detection and proactive management can dramatically reduce the risk of diabetes, heart disease, and other associated complications, allowing individuals to lead longer, healthier lives. Awareness and lifestyle changes remain the most effective tools against this modern health challenge.